Hi, good evening, everyone. Thank you very much for joining in this program. We are very grateful to all of you for the interest that you have shown by joining with us today. There has been a tremendous response from doctors across the country. We have more than almost 500 people who are live now, and a lot of them have come from all parts of the country. So we have participants from Northeast India, East India, South, West, Central, North. So once again, I'm very grateful to all of you for the interest that you have shown in this program. I think it's telemedicine is the hot topic of the day, and everybody is interested in understanding how can we do it safely, how can we be safe. So before going forward, I just wanted to say that this program was conceived because there was a lot of confusion and misconception regarding telemedicine and teleconsultation amongst the medical community. And we realized that doctors need to be safe while they are practicing. At the same time, they must go forward and understand that this is the way to go. This is a very easy way to connect and manage your patients, but at the same time, you have to be wise. So I'm very grateful to the panelists. I have a very eminent group of panelists here. I would like to introduce the panelists. Dr. Achal Gulati. Dr. Achal Gulati is Director Principal of BSA Dr. Ambedkar Medical College in Delhi. He was Director of Panth. He is Director Professor ENT, and he is also seriously connected with some of the officials in various ethical committees of the hospitals and even in the government. I don't want to go further. He's a very influential and industrious person, a big leader in the community. Thank you, Dr. Achal, for joining with us. We have Dr. Ravindra Wankhedkar. Dr. Wankhedkar was the national president of the IMA. He is the world, he's a treasurer of the World Medical Association. He's a very renowned, well-known personality amongst doctors. He's a very tall personality. He's joining us from Maharashtra. He has been very busy trying to get the Maharashtra government aligned, and he told me that he's been constantly helping the secretary and the minister to understand the doctors' issues and manage this COVID-19. Dr. Wankhedkar, thank you very much for joining with us. Really appreciate you. We have Dr. Ajay Bedi. Dr. Ajay Bedi is Vice President. He's an anesthesiologist and a critical care specialist. He's Vice President. I forgot to say Dr. Wankhedkar is Professor Emeritus for Surgery in a medical college. We are very grateful. We have two very renowned medical teachers with us. We have Dr. Ajay Bedi. He's an anesthesiologist and a critical care specialist. He is Vice President, Delhi Medical Association. He is the Secretary of the Nursing Home Cell. He also has his own hospital in East Delhi. I'm very grateful to Dr. Bedi that he joined us in this program. The doctors will give us not only the doctor's perspective on how to manage this thing, but will also tell us how doctors can be safe while doing it. So that's where the doctors come in. Then I have Mr. Sudhir Rohilla. Mr. Sudhir Rohilla is a 25-year-old veteran in healthcare technology. I think the first HIS implementation in this country took place in Tata Main Hospital in Jamshedpur. Mr. Rohilla was the one who actually led that implementation. He is an engineer from BITS Pilani. He has worked with PwC as a consultant. Now he runs his own company called Unyscape Solutions. He is a 25-year-old veteran in healthcare technology. His company provides healthcare solutions not only in India, but across the world. Thank you, Mr. Rohilla, for joining with us. I really appreciate your time that you gave to us. We are just now, last but not the least, and the most important person is Advocate Shri J.K. Bhola. Shri J.K. Bhola is a 25-year-old veteran in litigation. He is not only represents clients in Delhi High Court, but on all subordinate courts, and has also extensive practice across India. He is the person that you will go to when a doctor is sued. He's the one you will go to and say, please save me, I'm getting sued by a patient. He's an expert on medical malpractice and on MLCs. So thank you very much, Mr. Bhola, for joining with us and giving us your time. We will be happy to listen to you on how we can practice safely within the ambit of the law. Thank you, ladies and gentlemen. We are starting straight away. There has been an unprecedented, overwhelming response to our invitation. We have more than 100 questions that were asked. It is not possible for me to address all the 100 questions in one shot, so I have tried to create a plan around it. So in the next 30 minutes, we will be addressing these questions. I will be framing the questions on your behalf, and we will have the panel answer them. That should cover 80% or 90% of the questions that you have asked. Then after that, you still have any questions, we will go live and we will keep on asking you we try to answer your questions. There has been unprecedented interest. Let's start with the first question. So let me open this up by saying, by the way, our program today is not only going live on Zoom, but it is also available on Facebook Live. It is also available on YouTube and also on our website. So Catex Health channel. If you want to see, if you're not able to, join in because the room is full, you can always see us on Facebook Live and also on YouTube and also on our website. It's going live everywhere.